Welcome to the OAO Member Spotlight, your chance to get to know your colleagues in a new and engaging format. Each month, we highlight a member doing something unique and interesting, something you can take inspiration from and maybe even implement into your own practice. Sit back and enjoy the OAO Member Spotlight.
I'd like to welcome everybody to another Member Spotlight, and today I'm pleased to welcome Dr. Patricia Fink, who's going to talk to us about vision therapy. So before we dive into that topic, Patricia, can you introduce yourself to the audience?
Yes, thanks, Jeff, for having me. It's a great honor to be part of the Spotlight. I am an optometrist in Burlington, Ontario. I graduated in 1995 from the New England College of Optometry in Boston. It's been 20 years. I don't know where the time's gone. It's really, really fast. And I love it. I love optometry. I'm passionate about optometry. And I'm really enthused about the path that optometry is taking. So yeah, I want to keep going. I don't know how people are retiring at this space, but I'll keep going. So
vision therapy seems to be a very hot topic at the moment. A lot of optometrists are talking about it. They want to get into it. But before we dive into that piece, I'd be curious to hear from you what your definition of vision therapy is.
Well, for me, vision therapy is a series of specific integrated exercises that are in a specific treatment plan for the individual. And it's meant to rehabilitate dysfunctions of the visual system, but also to enhance visual skills in individuals such as athletes. So it's just not the same run-of-the-mill exercises that we learned in school, pencil push-ups and increasing ranges and things like that. It's really an integration of all of your senses, which is much more than the 20/20. We've always been assuming that if you achieve 20/20 vision in each eye, that binocular function is normal. And our learning disabled children are really showing us that, because they generally have 20/20 vision in each eye, and they go to an optometrist and they're told they're fine, there's no problems with your eyesight, your issues are not visual. And understanding that more and understanding the integration of vision into balance, tracking for motor integration, and that vision is really part of the brain. It's not at the level of the retina.
So Patricia, you mentioned you've been practicing for 20 years now. Obviously, you haven't been doing vision therapy for 20 years. So what got you started? What piqued your interest in adding this to your practice?
Well, in terms of adding it as a service to my practice, that happened about 5 years ago. And that was mainly to find another way of enhancing services at the office, as our optical got severely corroded by the gray glasses issue, as there was one in our neighborhood, and we were looking to keep our practice going by adding another service. Personally, though, I was always interested in vision therapy. I actually needed to do a 12-week vision therapy program while I was at school, as I was a very large exo. And I couldn't fuse behind a slit lamp. I was seeing two eyes. And that wasn't going to get me to pass my ocular disease portion of my second year. And they did an evaluation on me, and I had to go in office to do a 12-week program to work on my base out ranges in order to fuse behind a slit lamp. I still need to have a short ocular slit lamp to help with fusing, but it was the first time I was exposed to another aspect of vision that wasn't related to refraction and ocular disease, and I was really, really interested in it. And I actually did a binocular vision rotation through the Vision Institute of Canada with the intent of starting a vision therapy when I graduated. I just found it extremely difficult to get started. It was mainly home-based, and so it never really got off the ground, and I shelved the books that I had to do all the testing. I says, well, I got to work on just doing routine eye examinations, and luckily the situation in our optical market forced us to look back at doing vision therapy, and I'm really, really pleased that we did.
So now that you have this extra skill set, this extra expertise, I'm curious to hear your answer to this next question, but does it impact how you do your, quote, sort of regular eye examinations? Do you look at each patient differently now?
I do. It's really hard to separate that out as something different from the whole body. At the start, I just did, this is vision therapy, this is routine examination, but the refraction is an integral part of the person's functioning. And I think my patients benefit from having a balanced perspective on getting the right and left side to work cooperatively together, and to avoid issues such as initiating an eye turn by prescribing possibly too much cylinder, or getting them to be so locked in that they become more and more myopic because they don't have the necessary visual skills at near to not give up a part of their vision, which would be their distance. So it now affects everything that I do, and more people are coming to see me specifically for that, because people would like to have some control of what's happening to their refraction and to their prescription, instead of assuming that they have no control of it and they're just going in for a change in prescription because it's getting worse.
So now that you offer this in your local area, are you receiving more referrals from your colleagues? I know 5 or 10 years ago that would never happen, but what's your experience with that now?
Yes, we're really finding a huge increase in cooperativity in all aspects of optometry. I have a really good referral source of optometrists that are referring for these services, and it's an absolute honor to do that. It's still, most of our referrals are still coming from other sources, such as occupational therapy, physiotherapy, reading teachers. And it'd be really nice if more optometrists would do the referrals if they're not going to do vision therapy themselves. But they probably are not aware of it, because vision therapy today in office is far different from what I was exposed to in school. And until I took up the upgrade courses 5 years ago, I had no idea that vision therapy could do all of these things. I had no idea that vision therapy could straighten a strabismus, and that just blew my mind.
So if someone listening to our chat today wants to get started with vision therapy, wants to add it to their practice, where would you point them? Where's the starting point?
There's so many different ways to get started. The best way right now is to get involved with COVTNR, which is the Canadian Optometrists in Vision Therapy and Rehabilitation. That is www.visiontherapycanada.com, and there's a list of CE that's being offered. You can become a member. It is completely supportive to try to get more doctors into vision therapy. And that's a great avenue to go down to in order to see what's available for CE credits. And of course, the Optometric Extension Program, the OEP, that's how I got started in it, has been nothing but fantastic to me personally, but to my practice. They're constantly there to help with case reports. You're not just given CE and you're out on your own, and you're successful, and that's what it's all about. And it's a great way to train staff to become vision therapists themselves, which is also an added bonus to your practice, to have such dedicated staff that you can actually pay more, because vision therapy is rewarding financially for a service, and that kind of staff stays with you because they are devoted to the patients, and they're devoted to the practice as well. So you get some loyalty all around. So those are two great places to get started. The other one is COVD, which is a certification program. They also have some great critical concept courses that are coming to Canada. Getting your certification is highly recommended, as more and more insurances are expecting to see some form of certification in order to ensure the patient's revision therapy. So all around, we would like to see more optometrists in Canada do vision therapy in office properly, not just with a computer program, and not just pencil push-ups, to actually do an in-office therapy program for their patients, and to educate and get more and more doctors involved with it, as only 2% of Canadian optometrists are currently offering in-office vision therapy.
So just so folks know, I will put the links that Patricia, that you just mentioned. I'll put them in the description of the video so folks can click on that. Perfect. After they watch. Speaking of which, I guess in the fall of 2014, you received your fellowship in COVD. How many courses, how much time, how many years did that take you to achieve that substantial goal? That's wonderful.
Thank you. Yeah, I was a little crazy. I fast-tracked it. You do need to have a good 3 years of in-office vision therapy cases under your belt before you can start a fellowship program. But I did it in 10 months. I started last January and finished it in October. It is very intense. You have to do a lot of case reports. You have to answer questions. You have to do an oral examination as well as a written examination. The oral examination is very, very difficult. It's a 3-on-1. You really do have to know your stuff, but it is so worthwhile. It's such a worthwhile process. I have to thank Dr. Angela Peddle for being a fantastic mentor to me, and Dr. Shirley Hoff for going through the process with me. It's a great group of people. There's nothing more cooperative than vision therapy doctors. It's a real home for optometry.
Well, thank you. Thanks, Trish. Thanks for sharing your story about vision therapy. I hope the membership finds this interesting. I'm sure they will, because like I said, it seems to be the buzz in the optometric community, and more optometrists, I think, are wise to look at adding this to their practice, because like you said earlier on, it's more than just getting the patient to see 20/20. That's so important.
Yes, thank you so much for having me, Jeff, and continued success with the OAO. I'm thrilled.